baseball season, and if your kids are pitching and playing, our next guest has great advice for preventing injuries. We welcome back wellness expert Dr. Paul Reed. Thanks for joining us.
Yes, excited.
Baseball season. Oh my gosh, gotta love it. Gotta love it.
Yesterday was perfect. Today not so much with the weather.
Yes,
that's all right.
You can still throw. You can still play a little bit, right? Of course, undercover. All right, we've got Sam here to show us because
Sam is our demo.
Baseball season, it's all that throwing. I mean, year after year, you see kids getting injured a lot earlier, a lot younger.
A ton of repetitive stuff, and they're playing year-round like we've talked about before, so it's even more important to be proactive and make sure they're stretching and strengthening and taking care of their body so they don't get hurt when they get old like us.
All right,
so,
what can we do at home as parents?
Yes, so first thing is a parent is to check your child's posture, because posture relates to function. So if we have big deviations and kids are carrying a backpack on one side more than the other. So like if we look at Sam, we can see that one shoulder's a little bit lower, right?
Right.
And so I teach them to do a mirror image. So
are you right-handed or left-handed?
I'm right-handed.
Okay.
Yep.
And that one's
and
lower.
so we would teach them to go, if we have a low shoulder, to go to the mirror, right? And then they'd lift that shoulder up and just hold that and do some mirror image posture strengthening, and that's kind of reprogramming the brain to the body to want to strengthen and stabilize that.
Do you also say to switch the backpack then, too?
Yeah, or I try and teach kids to wear, and we can do a whole thing on it, but they should be wearing them on both sides to wear it properly. Yeah.
And is it usually, since he's right-handed, is that very typical?
Kids will dominate to that side,
And that's the side that's lower?
Yep, typically.
Okay, so it's as easy as
so
looking
easy
in
as
the
getting in the mirror, close your eyes, see where you're balanced. Oh, that side's low, I'm gonna raise it up, contract, hold that, relax, up, control, relax.
Should you be doing this now or when you start seeing problems?
No, they should. You can check that ASAP. So that's the best.
Are you doing that in the mirror, Sam?
Yeah.
Yes.
Awesome.
So some strengthening exercises, right? So we want to stabilize that shoulder. So I'm gonna have Sam. So if he's here, right? And hold on to that there, buddy. Squeeze it. Make sure you don't snap me. I don't want to embarrass you, right? And so I'm going to do some resistance, and he's want to strengthen those internal rotators. So if he pulls against that, brings it to his belly, bring your hand to your belly, good, right? So that's some resistance exercise. So that's going to strengthen his internal rotators.
Okay.
And if we do just the opposite, I'll let you do it, Kara. You can hold it there, right? And then he's going to pull towards me, and that's going to strengthen his external rotators.
What should we be looking for there when he's doing
Well, this is just more of a strengthening. So we just really, so it's light repetitions, don't need to go heavy. Again, it's just about doing it over and over again to stabilize that rotator cuff with that repetitive motion that they're doing.
You don't have a band, can you do like a can of soup?
You could do a can of soup, or mom or dad could just do some, if we didn't have that, if we let go of that, buddy, and if mom or dad just put your hand there, just do some light resistance, pushing against it. Same thing here, stabilize the elbow against the body, pulls in against it there. So that would work just as well if you don't have to. But you can get that at any athletic store, super cheap.
Right.
Easy for them to use, yeah.
At what point should you tell them to stop? If they're coming home from practice and saying, my shoulder's hurting me, is it an ice situation or is it a layoff?
If it doesn't go away in a day or two, then that's something you want to address it and make sure that they're not, that repetitive injury creating a bigger problem. If it's like a little soreness, like hey, we're just starting, we're going out, we're throwing, I'm a little sore, I'm breaking, I'm getting some new movement, no big deal. But if it's like, hey, we're a month in, this isn't going away, then you should probably want to have it looked at.
Should you be icing?
Icing for sure.
Okay,
yep,
so after practice, icing.
Absolutely, yep.
All right, are we putting Sam on here?
Let's show him, So Sam, go lay down your back, buddy. So if this is another thing that mom and dad can do at home.
Oh,
hold that. So it's just stretching. So those muscles that we just strengthened, same thing here. So you'd want to stabilize the shoulder in neutral and then stretch, right? So we're going to stretch that anterior shoulder and the pec there, right? So that's going to help stretch that pitching arm. And then just the opposite, right? So you come down, keep it neutral with his body, and then keep the elbow there, and then the hand down. So see, he's tight there. So we need to be working on it, right? So that shouldn't lift up like that. So this is some stuff we need to work on with him, right? Because that stretch right there.
So how much should he lift? Because we're actually seeing him lift up quite a bit.
Yeah, so we would want to go to where he starts where it starts to come up, and that's like his stick point, essentially, and then stay there until he starts to get more motion in there.
What are the best stretches before practice?
Actually, I'm of the theory of more movement than a stretch, an active stretch or warm-up versus a static stretch like that. So light throwing, do some of those without resistance. Again, just bringing blood flow to that area to get it warm before you go out and practice. So,
all right. Thank you so much.
You are so welcome.
Great information because there is a lot of injuries happening and I appreciate it before it's all started.
Yeah.
Thank you.